kwenye mtaa wa Chiga katika kituo cha afya cha Chiga, eneo bunge la Kisumu Mashariki, mahali ambapo Mheshimiwa Profesa Peter Nyong'o, gavana wa jimbo la Kisumu, anatarajiwa kufungua rasmi kituo hichi cha afya na vile kufungua zahanati ambalo limejengwa hivi karibuni. Ukitazama hapo nyuma utaliona. Na vile Mheshimiwa Profesa Peter Nyong'o pia vile anatarajiwa kuhudhuria uhitimu kwa wale wafanyikazi wa umma ama jamii linalojulikana kama community health workers. Na vile Mheshimiwa Profesa Peter Nyong'o, wakazi wa hapa wanamtarajia kupewa gari la wagonjwa almaarufu ambulance. Na vile wafanyabiashara ama wafanyikazi wa hapa tuliozungumza nao hapo awali wamesema ya kwamba hapo awali walikuwa wakifanya kazi bila malipo, na hivi sasa wanamtarajia Mheshimiwa Profesa Peter Nyong'o kuwapa mishahara ama kuwapa marupurupu kwa lile kazi ambalo wamefanyia jamii ya watu ambao wanaishi hapa.
Okay, good afternoon everyone. My name is Lilian Chacha. I come from Chiga Health Center. I'm the facility receptionist. Above that, I'm also a community health worker. We are happy today that we are addressing this occasion. Among the activities that are happening in our facility today, our governor will be coming today to officially officiate our new maternity wing, which we've been longing to have for a very long time. It is going to be of an importance because now our mothers who are maternal mothers will not walk so far to cover a very large distance before coming to give us babies, because no woman should die while giving birth. Again, we are hoping that the governor is going to give our facility a very big ambulance so that we may refer our mothers whom we cannot help or manage here at our facility. Again, we are hoping that our facility will be upgraded to sub-county. We want to thank the governor today for giving us the opportunity to have a maternity, because sometimes our mothers suffer due to bad roads, sometimes they suffer due to weather, that they cannot make it to the facility to deliver well. And also want to thank him because he has given us very many nurses and able staff that are able to take care of our mothers as they come and any other general patient as she or he comes. In the aspect of CHVs that are community health workers, I want to thank him because today we are marking our graduation day. My fellow community health workers are coming here to be graduated. When we started this project or this program of community health volunteers, we were purely volunteers. But I want to thank our governor for taking us this far. Now we are being given stipend that motivates us. Initially when we started, we were given books. We could walk with books to different places, to different households as we visit our households. But recently, since last year, we were trained on ICCM, that is the use of phones. And all of us, the entire county, are trained on the use of phone, that is digital life. I want to thank him for that because now our CHVs cannot carry those big books as they go to visit their household. They only carry their phones, that is our tablets. We want also to thank him because at least he has changed us, he has motivated us, and again he has made us to learn so many things through the entire county structure that has enabled us as community health workers or people who have passion to serve the community to be here today, to celebrate him, to celebrate all of us as community health workers. And I also want to celebrate them as well, the entire community health workers, for their continued support to the community, for the good work that they do to the households that we take care of, because
Kwa sababu leo ni kazi kirasmi, nitasoma hotuba yangu kwa lugha ya Kiingereza ili hao wasungu wasikie, na ili wale ambao wako nje ya Kenya wasikie pia vile inatendeka hapa leo, kitu kubwa sana na muhimu. Ladies and gentlemen, we invite the guest health workers, all protocols observed. Give me happiness to come here today to see our development achievements, especially in the delivery of health services in Kisumu East Sub-County. As my dear friend, Dr. Gregory Ganda, who is both my chief officer and my acting CEC in the Department of Health, and his team. In the year 2018, our immunization coverage was at 52%, and mothers delivering in hospitals were a paltry 28%. something had to be done. When I was Minister for Medical Services for 5 years in a coalition government headed by marehemu Mwai Kibaki na Prime Minister Raila Amolo Odinga, that coalition government did a lot to try and improve the health care in our nation. And we introduced the need for universal health care, but we didn't go very far. The new constitution in 2010 gave counties the responsibility of health and basic childhood education. That constitution would not have done any better than do that. Because primary and community health care, as the Cubans have proved, is really the basis of health care, the basis of universal health care. A proper ECD education, early childhood education, with proper nutrition and health care, is the foundation of successful education. Over the past few years, we have invested heavily in expanding our community health services. We increased the number of community health workers from 316 in 2017 to the current 476, and the number of community units from 21 to 44. Makofi kwangu basi. A bit more. To improve supervision, we hired more community health assistants, increasing them from 18 to 30. Today I'm very happy to note that our investments in community health systems have increased deliveries in hospitals by 20%. Our immunization coverage in the county has also increased to 76% over the same period. This is a marked improvement for the sub-county that deserves applause. Wapi applause nini? Work has been done and the damn numbers don't lie. Titire. As we celebrate these leaps and bounds, we appreciate that more needs to be done for this sub-county to catch up with the rest. My team reviewed the situation and noted that a number of our mothers were either delivering at home or having to traverse to Kisumu Central due to poor access and unavailability of facilities. We have therefore improved the number of our maternity units in the Kisumu East sub-county. I am happy to note that over the last 6 months alone, out of the 7 new facilities we have operationalized in Kisumu, by equipping and recruiting personnel, 2 of these new units, Obino and Ongadi, are in this sub-county. Also benefiting from new staff and equipment to allow them operate 24 hours and Chiga Health Center in Kolua East and Alunya Health Center in Kolua Central. Mabwana na mabibi, and wao wasio na mabibi. Nyong'o maternity, which I visited earlier today, used to conduct only 1 delivery per month last year. I am impressed that they are now recording up to 25 deliveries a month. I want to congratulate our mothers and our men who have been very active in this area. The benefits of the new Facility Improvement Funds Act, which I recently assented to, are already seen and are evident. The team in Alunya has improved the ambience in the maternity wing, buying new curtains and improving the client experience to meet their expectations. They are now able to serve their clients with nutritionally balanced meals and hot beverages, as I said earlier. This is also evident in Chiga, where the facility has invested these funds in purchasing the new curtains you saw in the new wing and having a fresh coat of paint in the facility. Ladies and gentlemen, We acknowledge the role of the community health workers in generating vital health data at household level and also in delivering high-impact community health interventions. Community health provides an avenue for further expanding access to healthcare. By availing this service at your doorstep, it absolutely gives me immense pleasure to celebrate the graduation of the community health volunteers, health workers, not volunteers, our frontline agents in the push for better healthcare for the people of Kisumu County. It is worth noting that all these achievements have happened within 5 years. We have lined up more landmark development achievements not only in Kisumu East, but across the entire county. This explains why we are humbly asking for a second term during the August 9 election. As we are preparing and have prepared our manifesto, we want to be very frank and honest to the people of Kisumu that we are only asking for a second term because we have done something. Because we have done something. Therefore, in every sub-county, we are going to submit to you each sub-county manifesto which says, Wasetimu Wadoktimu. Wasauru, Wasetimu Wadoktimu. Wasetimu Wadoktimu. Odien! It is obvious that a new regime will frustrate these good projects if it's not us. The graduation today marks the end of a number of intensive 12-day training held over the last 6 months, covering all the 469 community health workers in this sub-county. Each one of them has been armed with a digital tool to improve their efficiency and a bag containing requisite tools. This means that all the community health workers assembled here today will deliver quality services and provide real-time data which will support timely decision making. Together we shall significantly reduce preventable maternal and child death and improve health outcomes for mothers, newborns and young children for generations to come. We shall not suffer the tragedy that Dr. Danda's grandmother suffered. I know for certain that by the time I was born, healthcare systems were improving, and we were born in a family of 11 children. We only lost some members in adulthood, not childhood. Therefore, things have been improving incrementally in our nation. But here in Kisumu, we must stop walking with the chicken and begin flying with the eagles. Our service will not only safeguard the health of our mothers and children, but we also entrench healthy community norms and strengthen the community health systems that will lead to the overall reduction of the disease burden. I am proud to officially commission and congratulate the 469 community health workers and wish them well on their duties and impact lives in the various community health units within Kisumu East sub-county. I'm also proud to expand access to quality healthcare services for the 21,086 residents of Nyong'o, Chiga, and Rubino within Kisumu East sub-county through the operationalization of Nyong'o and Chiga maternity units and Rubino dispensary. That operationalization of the maternity units and Rubino dispensary will not only provide access to a wide range of safe reproductive health services, but it will also improve the geographical access by lessening distance previously traveled by the community members to each of the health facilities. You remember Dr. Konda's story that his grandmother used to walk up to the city so many kilometers away and lose our children. Access is an important factor in improving healthcare. This just up our tip of the iceberg and the start. I am extremely committed to the health service delivery agenda, and there's a lot that is yet to come. When that time comes, we will happily come to Kisumu East and once again celebrate with the Kisumu East community. May I highlight some of these projects? Top of the list is to ensure that Gita Sub-County Hospital as a fully operational theater that is in the final stage. Once this is ready, the communities in Kisumu East will have access to specialized services, including cesarean section, minor and major surgical services. We also have Ongadi Health Center that is ready and will be commissioned anytime from now for the use by the people of Kajulu and its environs. Additionally, we will officially commission the maternity unit at Kowino Health Center. This truly is in keeping with my aspiration and promise for excellent quality affordable healthcare delivery to every citizen in Kisumu County. I am proud of the Department of Health, led by my friend Gregory Ganda, for taking lead and supporting this process, and the agenda to ensure that every citizen of the great county of Kisumu has ready and available access to the highest attainable standard of healthcare. The highest attainable standard of healthcare. No excuse. I assure you my support in doing this. In conclusion, I assure you and I assure the Ministry, the Department of Health, my unwavering support and resources as they continue to think through and implement health service delivery. As you know, the Azimio government, led by Raila Odinga, has promised and will implement 35% delivery of revenue to counties, above the 15% we are enjoying at the moment. And when this is done, we shall be more than ready and able to do more in the healthcare services and other areas. I reiterate my commitment to this agenda as the very core of my government and agenda as we go to the second term of my government.
Ni kwenye kituo hiki cha afya cha Chiga, mahali ambapo gavana wa Kisumu Mheshimiwa Profesa Peter Nyong'o alikuwa na mkutano, na kando na mkutano pia vile alikuwa akifungua rasmi zahanati ya Chiga lililoko kwenye eneo bunge la Kisumu Mashariki. Na pia vile kwa yale ambayo Mheshimiwa Profesa ameyazungumzia ni maendeleo kwenye kaunti hili la Kisumu akiwa gavana kwa awamu ya kwanza. Na kabla kufika kwenye eneo hili, Mheshimiwa Profesa alitembelea maeneo tofauti kama vile Obino, mahali ambapo pia alifungua zahanati nyingine, na pia vile Nyalunya pia mahali ambapo alifungua zahanati kama hili. Na baada ya hapo tunaona Profesa Peter Nyong'o akiwakabidhi vyeti wale ambao walijitolea mhanga kuwasaidia katika afya. Amewakabidhi vyeti vya kuhitimu, na kwa hivi sasa watakuwa wahudumu ama wale wafanyikazi wa jamii katika afya, mahali ambapo amewaahidi kwamba vile hapo awali hawakuwa wakilipwa mshahara, lakini kwa hivi sasa wakunga hao ambao walijitokeza walijitoa mhanga kuwasaidia wagonjwa pia vile atawasaidia, na baada ya kukabidhiwa vyeti atawalipa mshahara kama wale wengine. Na pia vile Mheshimiwa Profesa Peter Nyong'o baada ya kuwakabidhi hao, tumeona jinsi wale ama wazee wa kutoka kwenye jamii hii ya Kano wamemketisha kwenye kiti cha uongozi linalotambulika kama kigoda, na pia vile kuvaliwa taji la uongozi. kumaanisha kwamba alikuwa wakiwarai wananchi wa hapa ama wakazi wa hapa kumpigia debe na kuwa gavana wa jimbo hili kwa awamu nyingine ya pili. Na pia vile vile siasa imekita kambi hapa, ambalo amewarai wananchi wa hapa kuwapigia wale ambao waliteuliwa na chama cha ODM kama wale wawakilishi wodi, wale ambao wanawania viti vya ubunge, seneti na hata gavana, na kuwarai wananchi wa hapa kuwapigia debe ama kupigia chungwa mara 6 linalojulikana ama linalotambulika kama 6 Ps kwa lugha ya Kimombo. Na pia vile vile maendeleo ambayo Mheshimiwa Profesa Peter Nyong'o ametenda katika eneo hili la Kisumu, jimbo la Kisumu, aliyaonyesha dhahiri, na pia vile vile kuanza kuhesabu kuanzia A au hadi Z, na amewarai wananchi kujitokeza kwa wingi tarehe 9 mwezi Agosti mwaka huu na kuwachagua viongozi ambao watawaletea maendeleo, na pia vile vile kumpigia Mheshimiwa Raila Odinga ambaye ni kiongozi wa Azimio One Kenya Party, ambaye pia vile vile anawania kiti cha urais. Na ya mengi ambayo Mheshimiwa Profesa ameyazungumzia ni kuendeleza ama kuleta sura ya mpya ama kubadilisha sura ya Kisumu liwe mpya, ambalo linaweza kuwaleta viongozi tofauti kutoka nchini na hata kule ughaibuni kuja kusherehekea maendeleo yake. Nikiripotia runinga ya KDR kutoka katika eneo bunge la Kisumu Mashariki Chiga, jimbo la Kisumu, jina langu ni Omari Musa.